Welcome back to another podcast of Heal Without Harm. This one is going to be a little bit different. I was recently on the podcast Real Conversations with Jacob O'Connor. I wanted to keep the variety up and give you guys a little bit of a flip the script type of podcast, so I'm just going to insert that podcast here. If you really like Jacob O'Connor and the way he interviews me and his voice and how his podcast goes, please go give him a follow on Instagram or just simply follow his podcast on wherever you listen to podcasts. Let's get to it.
And welcome back to another episode of the Real Conversations podcast. I'm your host, Jacob O'Connor. Real Conversations podcast for those dedicated to doing hard things and living a meaningful life. Today, I'm joined by Dr. Clayton Dir, who's a doctor of physical therapy. In this episode, you can expect to learn common pain points, misconceptions around healing and general wellness, holistic healing and approaches, supplementation, optimized daily routines, hydration, why you should avoid surgery and try and address the root cause, and much more in this episode. Let's get right into it. I'm particularly excited for this episode because one of the topics often discussed in the podcast is just this idea that you can overcome both physical and mental challenges. Like you can push through, you can persevere, you can overcome whatever current situation you're in. And I try and hit on these concepts of along the lines of, I guess, holistic health, holistic healing, and different kind of protocols and things tools that you can implement into your life that can help you in that progression. And I figured it was about time that I had on an expert to kind of talk about these topics, someone who could provide more commentary, who's done more research that can just maybe give people a little bit more hope, things that they can practically apply, and just more tools in their belt. So today I'm joined by Clayton Dir, and I'll let you introduce yourself a little bit here, Clayton.
Yeah, so my name is Dr. Clayton Dir. I'm a physical therapist. Been in practice for about 5 years now. We generally call ourselves performance physical therapists, at our practice, just to try to set ourselves apart because people have preconceived notions of physical therapy, right? Somebody who's post-stroke, somebody who's post-ACL surgery, generally an older individual or a very, quote, broken individual. And although we help those people as well, a lot of the times, like someone like yourself is a great client of ours who isn't operating maybe at their highest potential or having pain every time they get to 8 miles in or every time they bench press over 200 pounds. Like we also focus on those athletes, and there's not many of us here in Wichita that focus on that. And so that's kind of how we qualify ourselves. But yeah, been in practice for 5 years and really learned a lot of pattern recognition on how to help people much more efficiently.
How does mental stress affect your physical body?
This is a whole can of worms that
it's a deep, yeah.
I can expose you to it ultimately. And so when it comes to psychological stress, I think it goes back to those learned behaviors. When you're under a lot of stress, what do you generally do with your body? How does your posture change? How do you sit? Like, what is your default pattern? I have found for me that I remember it was between 2016 and 2020, somewhere in there, because I remember what couch in the house I was sitting on. But I was sitting there in what you would say is a relaxed posture. And I realized that I am like chest up, like back extended, like, quote, postured up. And I'm like, I'm literally just sitting here watching TV. Like, why am I sitting like this? And I relaxed and I actually felt tension kind of leave my low back. For my wife, hers mirrored yours, kind of like that pain just inside the shoulder blade. Whenever she has like high level anxiety, she's like, that not my back it's back. And then it'll kind of start referring down her arm. And so the thing is when we are under psychological stress, and when I say psychological, it's probably more mental and emotional type thing, our body naturally guards in a certain way. And it's probably some learned behavior back in your childhood or something like that. However, the more that you can understand that stress is stress. If you have pain, you're under stress. If you are working out hard, that's stress. If you're under a huge deadline, that's stress. And the body doesn't really see it any different. And so what is the posture that you default to, and how can you get yourself to relax ultimately? Sometimes you can foam roll on the crossball. Sometimes you can do exercises that kind of like train that muscle to go back to the dimmer switch, turn on, turn off. Sometimes it's something that's needed like needle, scrape, popping of that area. And sometimes it's legitimately just laying on your back, legs propped up and doing diaphragmatic breathing, trying to tap more into your parasympathetic system, your rest and digest system, bring the heart rate down, calm things down. It's leaning more into that, or like Huberman, the NSDR, the non-sleep deep rest.
Yeah, mindfulness.
Yes, it's just being aware. And that's what blew my mind. I was listening to another guy. He said, the second I realized I could do a body scan, find the point of tension, be like, wow, I'm really holding tension there. Take 3 to 5 deep breaths and try to like visualize that melting away. It like broke his pain almost immediately. And so if you're somebody with chronic pain and you're under a lot of stress, I've recommended this book to 4 or 5 patients, and it's been life-changing for them. It's called Healing Back Pain by Dr. John Sarno. And he talks about this thing called tension myositis syndrome. And it's emotional stress turning into essentially myositis, which is irritation of the muscle. And the syndrome, essentially, you holding tension in a muscle, secondary to a childhood trauma or secondary to a psychological stressor.
Yeah. And I'm glad that we hit on that, because I think that's a big takeaway I want people to have, is that your psychological stress really does impact how you move and how you feel.
And it'll wear on you over years and decades, for sure, which is why 40 and 50-year-olds are the ones that are like in the most pain, and up from there, but in the most pain, but sometimes the hardest to work with. Not because you don't understand what I'm saying or you don't believe me, but it's like you've got that many more years like built up into this learned behavior ultimately.
Hey guys, Jacob here. Real quick before we get back to the episode, I just want to take a quick second to say, if you guys are enjoying this episode, please make sure to share the link with a friend. You may have noticed I don't run any ads in the podcast. In fact, I don't make any money off the podcast. It's quite the contrary. Over the past 5 years, I've invested a lot of time, money, and effort into the growth of the show, trying to continually upgrade the equipment, bring on better guests, and just improve the overall quality of the podcast. So if you guys are enjoying this episode, or if you enjoyed previous episodes, please share the link with a friend. Sending it to 1 or 2 people makes a huge difference for me on the back end. As always, I appreciate your guys' support. Let's get back into the episode. I think in general, people go too far into, I just need to get an injection or I need to have surgery, and they try and do something like permanent rather than addressing the root cause and, to use your own terms, healing without harm.
Yeah.
And so I'd love for you to kind of talk about like your thoughts on that, and then we can lead into my specific situation and other tools and just kind of the outline that we've put together.
Yeah, absolutely. So like you mentioned, I actually started a podcast at the beginning of this year called Heal Without Harm, because I kept getting more and more and more frustrated with what people would say when they would come in the door. They would be like, so when should I get my injection? Or how many times do I have to, I literally had someone say this, how many times do I have to come here before I can get my MRI? As if the MRI was going to be the end all be all,
Right.
As if it was going to like just unlock all their pain and make it all disappear. And what people don't realize is injections ultimately mask the pain, and they actually speed up the breakdown of soft tissue. So you're going to break down your tendons, ligaments, muscles, all of that quicker. Or they're quick to go on medication, and all of these things that don't solve problems, they just like wash them away. And so through all that frustration, I realized I can help every single person coming in the door. Don't get me wrong. But if I want to help more people, I need to talk to more people, and putting out good content when I get frustrated by other people's sometimes incorrect content, or like, oh, there's a new drug for this. And it's like, or you could live a healthier lifestyle. But if I'm not contributing to that, contributing to putting out that information, then ultimately it's somewhat my fault too.
Yeah.
And so that's where I picked up on starting that.
And I think it's cool because this is providing access to information that can really help people change their life. I know that there's people that are motivated to get started working out, or they have this goal, like myself, 100 miles that you want to hit. You keep running into these old injuries or developing new injuries, or you just have these misconceptions, these preconceived notions of things that might go wrong, and that you're not going to be able to overcome that. And so I guess similar to kind of what Andrew Huberman does with his podcast, like half the battle is just getting people the correct information and helping them feel equipped to actually tackle these goals that they have for themselves. So I'll kind of turn it over to you here. Like, I'd love for you to jump into maybe some of the preconceived notions, misconceptions that people have in general about holistic healing and different approaches to it.
Yeah. And so one of the things you talked about was you mentioned old injuries. And on some of the podcasts that I listen to, they ask the question, what is something you used to believe that you no longer believe, or vice versa? And I still remember in the first couple months of starting in practice, my boss said, like, everybody's going to need PT at some point in their life. And I was like, well, that's a really opportunistic statement, like, oh, eventually you'll come need us. But it's true, especially as I get older. I'm now 31, and then I treat, 40, 50, 60, 70 plus year olds. And I realized that my problems are I'll get low back pain because I've got a lot of flexibility back there, so I'll overuse it. My right shoulder is also super hypermobile. I can sublux it or slip it in and out like on demand. And so sometimes that gets overused. And so I've got these like certain injuries that I have hurt in the past that if I do enough of a certain task, it pops up. If my stress goes up and I'm not paying attention and not working on certain things, it'll kind of pop up. And so it's like this little revolving door if you don't go fix the problem ultimately. Now, I remember even when I was in clinicals, I remember thinking my shoulder's so slippery, all this kind of stuff. I'll probably just get surgery in my 30s. Like, it's just bound to happen.
Mm-hmm.
Again, preconceived notion. And now I'm like, I could probably just get a dry needle by my coworker, work a little bit more on this exercise, yada, yada, and I'll probably clean it up.
Yeah.
And I remember my wife questioned me one time. She said, how are you so confident you can help everybody? And in her defense, this was within my first year of graduating and practicing. But I was like, I've just seen enough people that seemed like too daunting of a problem to fix that we fixed within like a month.
Mm-hmm.
And I even had some of those preconceived notions of, nope, you're just broken. Like you're 40. Like you're probably going to need a total joint replacement, all this kind of stuff. And it's not necessary. It's not needed. And when you have proper evaluation, I think this is where it gets down into the details, is when you get properly evaluated from a musculoskeletal perspective, meaning let's go test this muscle, test this ligament, test the flexibility of these joints, see how you're moving. That's when we can go solve the problems. But when you walk into a regular medical doctor's office and you get 6 minutes with them to say, my shoulder's been bothering me, they're like, okay, cool. Let's go and get an x-ray. I'll go and prescribe you some meloxicam, which is an anti-inflammatory. If that doesn't work for the next 4 weeks, then we'll go ahead and get you an injection. You can get those every 3 months to try to like keep the pain down. And after 2 of those failed, then we'll get your MRI, and then you'll probably need surgery. No mention of physical therapy and solving the problem. And it's just enough of those stories have been said that I'm like, we've got to do something about this ultimately. And so that's ultimately what I've learned in my 5 years, and trying to teach every person that walks through the door what's going on and how to fix it themselves has been what's been so rewarding throughout that process.
Yeah. And I think that is the practical application of this episode specifically, is getting people the tools, the right questions, as much as they can do on their own. Like, I think it's great if ultimately they want to go and see a PT. I think that's awesome. I know that for certain people, it's expensive and it's difficult. So I would love for you to kind of start with like, what do you do to get down to that root cause? Like in my situation, I grew up playing basketball, and I used to get these muscular knots in my shoulder blade from, I guess, overuse or dehydration or whatever that root cause may have been. But that was a constant issue in high school. And as I've been ultra running, it's been something that's popped up even more. And it got to the point where I couldn't run a couple weeks ago. And so you actually were kind enough to let me come see you, and you dry needled me and you scraped me, and I never had that done. And it released it so much better than I've ever been able to prior, other than allowing only time to release it. And so I was amazed at like how you were able to do that. And I would love to maybe start off with like, how do people get down to the root cause, and what do you mean by the root cause?
That's a great question. I would say, first of all, when you say it happened back in like, basketball, is this a systemic issue or is this a local issue? Is it this muscle is having problems, or systemically you weren't recovering well, you weren't sleeping enough, you weren't getting enough protein to recover, hydrated, electrolytes, all those things. And then like your kryptonite spot was those muscles in the upper back. And so once stress levels raised up or recovery was down, okay, boom, now the problem is there. That's kind of the first thing. When it comes to anybody listening, I'm sure every single person listening that has a pain is probably in a different area of their body. And so I would first consider like, have you tried just what I would call like treating the area? Have you used a lacrosse ball, a foam roller? Have you had a friend try to massage the area? Generally, when I say massage or foam roll, I like a pin and stretch or a sustained hold. The reason a lot of the muscles go into spasm or they have knots, or sometimes we call them trigger points, all things pretty much describing the same thing, we just use different lingo. What's most of the time happening there is that muscle is stuck in contraction. A portion of that muscle is turned on and won't let go. And it's not your conscious brain, it's your subconscious brain, or something in the spinal cord saying like, we don't really trust this area, so please just stay in contraction because that's how we're going to protect it. And so when you have a sustained hold, whether it's somebody's thumb, elbow, a lacrosse ball, foam roller, sometimes a Theragun, but most of the time it's a sustained hold, you are going to elicit so much pain in the area that the brain is like, oh my gosh, this is horrible. And it's going to release what's called endogenous opiates. And it's your own opioid system saying, okay, let's send a bunch of pain relievers to the area. Oftentimes these theories are all still theories, but they work. The other theory is that we're starving the area of blood for a short term. And so once you let off, a bunch of blood rushes in and you essentially get this pumping action, and a bunch of inflammatory mediators go in and start to heal the space up. Unfortunately, most of the time that's only temporary. Massages can be very helpful. Usually you'll get anywhere from minutes, hours, or maybe a day or two relief, but you're not really problem solving. And so you need to couple that with some sort of training. I used to say strengthening, but it's not always weak, need to become strong, but it's like neuromuscularly, like not doing well, needing to be trained on how to work. Let me see if I can give one other metaphor or analogies. A lot of the times when people come in and they have a knot, it's almost as if the light switch in that muscle is flicked on. It's stuck in the on position. I cannot get this muscle to relax. You can take systemic muscle relaxers pills, right? But you're going to have a bunch of side effects and it's usually not very specific. So it's not very helpful. And so that light switch is stuck on. So at first I need to help get it to turn off. And then I need to have you learn how to get this muscle to turn on and off under your own power as you continue to train it. Now you have a dimmer switch. I want this muscle to turn on only as much as needed and then turn off only as much as needed. And ultimately now it will function appropriately. I would say in your case, or anybody else that aligns with your case where it's like, this bothers me here and there, and anytime I do blah, 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 it starts to hurt. In those cases, what I've unfortunately found is after we fix the initial problem, it's how long can we go before it bothers again? So for your case, let's say we quote solved that, it may be 6 months before it bothers you again. And then we start to zoom out and we zoom out and we zoom out. And it's like, cool, we fixed this up. It was probably less bad, lasted less long. And then we fix it. And then now it's 2 years before it bothers you again. Then it's 5, then it's 10. And then ultimately we get things cleaned up from there. What I would say is you said, what is the root cause? This is where in my evaluations, I will spend anywhere from 10 to 30 minutes communicating with the patient because they generally come in with preconceived notions on what they think is going on. And if I can get down to where's the flaw in their thinking, or where's the flaw in what they've been told, or where's the flaw in their movement patterns, that's where you get like lifetime change. And one of them that's huge is when you squat, your knees should not pass your toes. I don't know where that came from in particular. I preached that until like my last year of PT school because that's what we were told too. It's like these like myths that just get passed down, right?
Yeah.
Well, they did this study where they put a board in front of people's toes. So imagine just draw a line straight up from your toe or your toes up against the wall and you have to squat. Well, your knee's going to hit that wall pretty quickly. Unfortunately, the only way to get deeper into that squat is your butt to go backwards. And if your butt goes backwards, you're going to fall. And so you start pitching forward. So by the time you get to the bottom of your quote squat, you're looking at the floor. So what they did is they measured the essentially the force on the joints, and it decreased the force on the knees by 22%. It increased the force on the hips and low back by 1,070%. Huge trade-off, not worth it. Now there's times where you may want to use an exercise like that to offload the knees a little bit to get them to calm down, still strengthen and blah, blah, blah. But that is never a worthy trade, And so most of the time when people come in, we do what we call is take movement vital signs. You go to the regular doctor, they're going to take your heart rate, blood pressure, height, weight, all those things. What do you move like normally? Like if you're going to squat down to pick something up, what does that look like? Because you doing that 1,000 times for the next 2 weeks is the reason that your back is going to be in pain. So show me what it looks like. You fix that squat. Now every time they squat, they no longer have back pain. That's getting to the root cause, in my perspective.
Are you familiar with knees over toes guy?
I love him. I've actually bought into his programming, and there's like 4 or 5 exercises that I pulled from him that I use regularly because it's good stuff. And he has simplified progressive overload so well. So well. It's like, oh, you can't do this? Make it easier. Can't do that? Make it easier. Can't do that? Make it even easier. And it's like, okay, now you can do it. Make it harder, harder, harder. And they just build people up.
So for those that don't know, like he's given a lot of people hope with his program, and it's literally flipped everything on its head to where you're talking about you're squatting and you want to keep your knees parallel to your toes. He's actually putting you at an angle sometimes, getting you to squat forward so that your knees are even further extended over your toes. Like I'd love for you to kind of talk about what that's doing and why that's actually helped people with knees and back problems.
I would say to keep it super simple, it just goes down to, like I said, the progressive overload. Like not only are we made to do that, but he does it in a way that slowly progresses it so it's never too much too fast. Ultimately, you said, how does that help? This is where I would really want to be visual. But when you squat down, if you don't share the load between your hips and knees appropriately, one of them's going to take on that force. And so because he knows so many people think you shouldn't let your knees go over your toes, he very well marketed himself as like, I'm going to go directly to that and say, no, your knees are supposed to go over your toes. And now when they squat and they let the knees go forward, they're going to be way the heck stronger because now it's split between the two. And so when you're trying to squat down, your shoulders should stay right over about midfoot ultimately, which I guess if you say the knees are staying back and you're pitching forward, you are following that, but your butt's never going to get below chair height. And that's kind of part of the problem. And then you put a barbell on that person's back to where they're trying to stand up, looking at the floor with a bar on their shoulders. Then you're asking all of your low back muscles to like overwork. You're pinching the front of your hips. And so now you have people coming in and saying, every time I squat, I have hip pain, I have back pain, I have fill in the blank. And it usually boils down to their squat pattern is poor. And it's mostly because they were taught wrong.
So to make this even more applicable for people at home listening to this, what are some of the most common injuries And then how would you recommend they diagnose the root cause of those injuries?
So I would say it's really hard to diagnose yourself, even if someone's calling me like a friend and I'm trying to diagnose them over the phone. And maybe that's just how I am as a PT and how I practice. I'm very hands-on. It's like, I need to see this and I need to have you move in certain ways and me ask you, why are you moving that way? Hopefully not to be offensive, but to like, what leads you to think that's the correct way to move so I know what problem to go fix? We'll come back to the diagnosis part, but the most common injuries I would say is shoulder blade pain, and then sometimes pain that ends up going down the arm, secondary to the musculature there. Medial or lateral, so inside or outside of elbow pain, golfers or tennis elbow. Those are probably the most common upper body injuries. And then lower body is definitely going to be like hip pain, SI joint pain, or low back pain. Usually they're all kind of the same problem. They just present in different pains. Or it's going to be knee pain. What's interesting though is some things that I've learned is, I'll see if I keep this straight. Mobility issues generally start distally and move proximally. So if you have an ankle deficit to where your knee can't go over your toe because your calf is so tight, well, that changes everything up the chain. So now when you do squat down, your knees can only go so far because you don't have the flexibility. And then your actual complaint is I have pinchiness in the front of my hips or I have pain in my SI joint. And it all comes down to your ankle is immobile. So the root cause is we need to fix your ankle mobility after we put out the fire of the pain at your hip and low back. The rest of that statement that I've figured out is stability issues start proximally, so higher up in the chain, and they present themselves lower. An example would be plantar fasciitis, or people generally call it plantar fasciitis, but any sort of heel pain. It's usually a hip stability issue. If your hip or your big butt cheek is not stable enough to handle running, walking, or any sort of single leg activity and stabilize essentially the chain going down, so hip, knee, ankle, then the ankle is now having to try to like make up the difference for what your butt cheeks can't do. So you have all this excess movement every time you land on that foot with running, walking, whatever the sport is. And so now that's where the pain is popping up when we actually need to go up the chain and make you more stable at the hip. And then my job is to put all those pieces together, play detective and essentially solve it with you and for you. But those are some things that I've noticed in regards of common injuries.
Yeah. When I first started running, I met someone who's she's a really good ultra runner. And I don't know if she's actually a PT, but she's done a lot of her own research and things like that. And she started preaching to me and she would say, glutes and quads.
Mm-hmm.
Like, because I would have all this different pain, especially like in the knees and then a little bit of plantar fasciitis. And she was always just telling me glutes and quads, strengthen them.
Yeah. And I think one thing I enjoy about my job, but you could say this about anything, is when you first go in, you think you know all this stuff. Then you quickly realize you don't know all this stuff. You learn all these big words and then you're like, okay, I understand. I have no idea how to teach it. And then it comes all the way back full circle to, wow, it's so simple. And all I need to tell you is glutes and quads. And it really does fix most issues, ultimately. And then those couple unicorns that don't get fixed by it, those are the ones who go to PT. And so you asked, how do people diagnose themselves? I still haven't figured that out in particular. What I would say is if you have pain, follow the stuff that I recommend on like my TikTok and Instagram and stuff. And if that doesn't work, then reach out to me directly. And then I may be able to help you. And if not, then it's like, come on in. So it's almost this, I can't think, it's almost like a funnel, right? Like most people are going to be helped by just doing glutes and quads, for example. If that's not working, then go ahead and buy someone's like $10 program or buy into Neo over Toes Guy. I don't have any products or anything, but then go into a little bit more specifics. And if it's still not working, then go to a PT. But please, for the love of God, if it's just a tendonitis or like a knot in your shoulder and you don't think it's a systematic, I'm dying type thing, please reach out to a physical therapist first, because we are going to keep you out of the medical office. We're going to keep you out of injections. There's actually a study, I do not remember the details, but the second you medicalize musculoskeletal pain, like the cost and the cost goes way up, like on average. And the chance of chronic pain skyrockets. Because the second you have someone come in with general low back pain, which I would probably solve by like double checking the spine's moving fine, strengthen the hips, dry needle your glutes, and then like progressive overload. The second you tell that person you have degenerative disc disease or triple D or a small herniation, like that has now been planted in their brain and you cannot get out of their brain the fact that like, no, they said I have a disc issue. They say I have arthritis. That's the reason for my pain. And it's like, I don't know, because the lady that just left my office literally 2 hours ago said that she was diagnosed with arthritis in her neck and she hasn't had neck pain her entire life.
Yeah.
So is this a true cause? No, it's not. And I have more studies to show for it if you want me to. And that's so hard to work back from when they do end up in my office.
Yeah. I'm curious what you would think about this with regards to what you just said. Early on in college, I was having a lot of low back pain. And I mean, it got really bad. And it was really flaring up. If you're familiar with basketball, you do the defensive squat to play defense on someone so you're in a low stance.
Yeah.
So I was really flaring my lower back. And I'd been playing basketball since my entire life. So I was often in that stance. And I was having a lot of back issues. So I was going to the doctor. And it was like real bad. I was in a lot of pain. And the doctor, I don't remember if it was surgery or an injection, but they ended up saying I had like a low-grade osteoporosis. And so I was like, oh my gosh, like it's crazy. I'm so young. And like, I can't believe we're heading towards that route. My brother's had back issues and back surgeries starting in high school. Like I don't want to go down that route. I don't remember who recommended it, but they told me focus on your core, strengthen your abs. And by flexing your core, you can alleviate the stress on your lower back. It says it's become like a conscious effort of mine is focusing on my abs, even to the point where if my low back starts to hurt me during an exercise, I will consciously flex my abdomen to relieve the stress a little bit on my lower back. I'm curious what you think about that situation.
Yeah, no, I think it's a great question. And I remember seeing a basketball player. He was really tall, generally a post guy, and had a bunch of low back pain. And after about 2 visits, he finally got his MRI back, and he was actually diagnosed with, can't remember the exact diagnosis, but what I remember it was essentially a stress fracture of the back from always being in extension. Volleyball players have it a ton too. Defensive linemen can have it because they're always getting pushed up into that extension. But you said a word, you always flared your low back. I think this somewhat still goes back to that don't let the knees pass the toes. In general I always joke how like football coaches yelling chest up, butt back is like the reason I still have a job. And it's when you stick your butt back but keep your chest up, you're going into all of this extension of the low back. Well, that does 2 things. That one keeps your spine in constant extension, but then it teaches your low back muscles to always be on and they never get a break. And so then you have low back pain secondary to the muscles, which I would somewhat call a tendonitis, or it's almost that muscular spasm. It's a learned behavior. Your low back is like, no, we stay on all times. So they never get a break. But if you can picture someone, I've actually prescribed this to people. I was like, I want you to put your hands on your knees and I want you to look at yourself in the mirror on the side and I want you to essentially slow motion twerk. Because you need to learn how to tuck your tailbone underneath you. Ab contraction.
Cat and cows. That's what they had me do.
It's like a standing cat-cow. The downside with the cat-cow is when you're doing the whole spine, it's like people have no idea how to localize. But when you are in like like when you're really tired, you put your hands on your knees. In that position, you're stabilizing your thoracic spine, your rib cage, essentially. So now all movement has to come from hips and low back or pelvis and low back. So then you can isolate, like, look, when you go into extension and they have pain, you're like, that's why you hurt. Like the second I can identify someone's pain and recreate it in the office, that's when I know I've got them sold. And then I say, okay, now contract your abs, pull your belly button in. Imagine you could almost say humping the air or like thrusting forward or shine your belt buckle up at the ceiling. You get that tuck where it's like the lower abs are pulling up on that pelvis. It opens up the low back and actually gives permission to those muscles to relax. And they're like, oh my God, that feels so good. And I'm like, yeah, do that 100 times every day. Like not a literal prescription, but once you can learn that movement, like you said, now I learn when my back hurts, I engage my core. You're essentially doing what I just described. And now you can alleviate that pain. Now imagine if that was your standard posture, if that's what you learned, if that became the new learned behavior. That's how you alleviate that low back pain.
And that's what I think is so cool is like you talked about it being a light switch, like your muscle is on, you want to learn how to shut it off. Like that was something cognitively that I could engage that offered relief and changed the pattern.
Yeah. There was one guy, he was mid 40s, came in and he said, every time I deadlift over 225, my back just like screams. It took me 45 minutes and like every drill I could pull out of my brain to get him to figure out how to tuck his tailbone. And so what ended up being is laying on his back, knees bent, feet on the floor, essentially the beginning of a bridge or a hip thrust. And I slid my hand under his low back and I said, smash my hand. Now, after 45 minutes of a bunch of different drills, that's what it finally came down to. And once he figured out how to click that in and he was like, oh, that's what you want? And I'm like, yes, that's what I've been working on this whole time. And I said, now do you feel your abs are turned on? And we talked about that for a sec. And then I said, now I want you to carry this over into your deadlift. I saw him one more time after that and he never had pain again. But that was also because he went and did the work and learned and set it into his brain. But that was the movement unlock. But if I'd never taught him that, he never came to me and he just went into, a surgeon. It's like, all right, well, your L5 is kind of getting a little bit worn out. So let's just go ahead and, screws, bars, and let's stabilize that. And then here we go on a bunch of medical costs, a bunch of potential chronic pain, and then a whole slew of things.
So one of the things I want to hit on, because I talk about it often in the podcast, is recovery. I'm a huge advocate of sauna ice bath. I've been preaching this for years. This is your opportunity to shoot me down and provide what you think about that.
Yeah. So I would say sauna, I think, is all upside. Ice bath, I keep going back and forth. I think I'll go between opinion and like science. And I think most science shows that ice bath doesn't do all the cool things we thought it does. And most of the studies that are coming out now showing that ice bath right after a workout actually like halts protein synthesis or muscle building.
Oh yeah, I wouldn't do it right after.
Yeah. And I don't know if they've isolated how long to wait type of thing in regards of like ice bathing relative to your exercise. But definitely I haven't seen anything positive about doing it right after in particular. What I found personally to be the biggest benefit, and when I talked to Hunter at Sweat House, he talked about all the mental aspect benefits. And I think that's where I would put it, is like just getting yourself to do that hard thing and then staying in there. And then the second layer being like breath control. Can you control your breath in this harsh environment? And then I do think there's a little bit that I've read that talks a little bit about being comfortable with cold, and then like some certain brown fat kind of like synthesis, which is generally the metabolic the higher metabolism brown fat. So that's about what I know about ice baths. So I don't stay away from them. I don't think they're bad or anything like that. But I haven't found the best timing for them other than just like first thing in the morning. So the days that I do them, I wake up essentially and go to Sweat House and go do that. And then I may work out later in the day. Now, when it comes to sauna, what I've found there is it depends on the sauna that you're in. Infrared generally seems to be the staple because it's like actually heating you up, as opposed to just being in a hot room, ultimately. I think the good standard is 30 to 45 minutes if you've got the time availability and you can actually stay in there for that long. That's where I've seen most of the benefits coming from there in regards of it's almost like zone 2 training without having to actually go do the work, ultimately. So it's a great way to get the benefits and the cardiovascular benefits without having the muscle breakdown in that aspect. And so that's where I put, like, if it's my basket, I'm putting more eggs in the basket of sauna over ice bath.
Yeah. So here's how those things kind of play in my head. The ice bath, I've heard not at least 2 hours before a workout. Like, you don't want to do it. You can do it right before the workout, but I for whatever reason have in my head 2 hours before the workout, and then not within 3 hours after the workout, because your muscles are trying to repair themselves since you just stretched them and broke them down, and getting into the ice bath immediately after hurts that process. Doesn't the sauna actually increase or speed up protein synthesis, which actually recovers the muscle?
I'm not gonna lie, I have not looked into it in depth to confirm that. Okay. It would make sense, just because in general, if where blood flow goes, healing goes. And so if you can systemically, like whole body, get increased blood flow, like go for it. It's probably going to help. And I don't see any negative to that unless you have an active infection or you're actively bleeding. If it's not one of those two things, the sauna and increased blood flow is going to be helpful, especially because you're not having to further break down tissue via running or workout to get that heart rate up.
So I guess one thing that I've assumed is true that I'm curious on your thoughts, going from hot to cold, cold to hot, whatever, in a pattern, also known as contrast therapy. In my head, that makes sense because vasoconstriction occurs in the ice bath where the veins get smaller, so there's less blood flow pushing through. Vasodilation, is that the other one? The veins expand and open up whenever you're in the sauna because of the heat, and so your blood flow actually increases. In doing that throughout the blood flow, I don't know exactly what's happening there, but in my head, it's like that change in that pattern and the increased blood flow actually helps with your recovery.
So if I understand correctly, if you're at Sweat House for an hour, you're generally doing how many ice baths when you go?
3.
Okay. And so I see where you're coming from. And we learned about that back when I was in athletic training school at OSU. But when we actually started like reading into the research, going into PT school and then doing it on my own, I don't know if it's not well studied or if I can't find the studies, but I haven't found anything to like very solidly back that up. From a critical thinking perspective, I'm 100% with you. But I think there's also more that we're learning now that they can do fancier research studies on like metabolically, what is it doing? Like I talked about the brown fat and stuff like that, or how we actually know it stopped protein synthesis. I don't know if that research is fully out yet to back that up. But I was talking to Becky, the owner of Compelled, and she was talking about this menopause class that she puts on. And she said, one of the most important things I tell people is the most important research study is still an N of 1. It's you.
Yeah.
Does it help you?
Anecdotally.
Exactly. For 2 reasons. 1, I want to make sure it actually helps you, regardless of what the research says. But 2, if you think it's going to help, it will help. Like placebo is a real thing. And I think the thing is placebo is the power of the mind. There was another study done that goes into this, not on the muscle recovery thing, but it reinforces your beliefs. They had people, they had a group of people drink a milkshake that they told them was low fat, low calories, 350 calories. And then they tested the amount of ghrelin produced. Now, I can't remember if ghrelin is the hunger hormone or the satiating hormone, but they measured how much was released based on the understanding that this is a low calorie milkshake. Then a week later, they did the same thing. They gave them the exact same shake, but they told them it was high calorie.
Mm-hmm.
And they were more satiated, aka more full, after drinking what they thought was a full high calorie drink, even though it was the same one. So it doesn't matter necessarily what's coming in. It matters what's perceived. I would argue it's both.
Yeah.
But with the fact that you can change your hormone levels based on what you think you're consuming is insane. It makes sense, but it's insane. And so if you think that this contrast therapy is helping and you have no reason to disagree with that because you feel great, then I'm saying all for it. Go for it.
Yeah. And I'm glad you brought up the placebo effect, because I was going to make the comment to the listeners. Going to this podcast, I knew regardless of what you said, I was going to keep doing it.
Yeah.
Because anecdotally, it's made the biggest difference in my life.
Mm-hmm.
So I wasn't going to stop doing it because I am a firm believer of the placebo effect. And maybe you can talk a little bit about what that is and define it for people. But you were asking me prior to this, I'm drinking Element, which is electrolytes mixed with alpha GPC,
Mm-hmm.
which is supposed to be a bit of a nootropic. And we were going to talk about supplements and kind of things in that realm in a little bit. But you asked if I thought it worked. And I was going to give you the answer of, like, in my head, I tell it myself that it works anecdotally. And so I do feel an energy boost from it. I don't actually know if alpha GPC increases my energy, but I know that the placebo effect at least is something that's working on me. And so that's why I continue to take it.
Yeah. And I don't blame you. They actually did another study. So powerlifting is a sport where they do the max squat, max bench, max deadlift. And they took a bunch of they took a bunch of powerlifters and they had them test their max. And then they gave them pills and they said, this is an instant acting steroid. They took it, waited 15 minutes, and not a single one went up less than 10%.
Wow.
So within a matter of minutes, within an hour at least, at most, they maxed out, took this placebo pill, fake pill, told it was instant acting steroids, believed that they were going to lift stronger, got back under the bar on all 3 lifts and increased by 10% or more.
That's crazy.
And so that's where it's like, honestly, if you believe it, like, that's the power of the mind. And I even had one guy, he's like, oh yeah, I solved my back pain by just thinking about it every day. And your initial reaction is like, okay, but it's like, good for you.
Like,
that's
if it worked, it worked.
Fantastic. Yeah. And so when you talk about supplements and using the alpha GPC and then Element and stuff like that, like, if you find something that works and as long as you're willing to do it, like, right, like if I told you that, rubbing cucumbers on your face for 5 minutes every day is going to help you and you believed it, it's like, but are you actually going to do that?
Right.
Or is it going to fall off? And it's like, it's pretty easy to like pour powder into a water and take a drink, And so if you're willing to pay the financial cost, you're willing to actually do the task and you get the benefit, then it's worth it to me. Now, Unfortunately, I hate when certain multi-level marketing companies prey on that.
Yeah,
and
no,
that's
I agree.
what's frustrating. And so that's where there's sometimes like a conversation to be had. But with the research that I've seen around nootropics, which isn't much, meaning I haven't actually looked into it much, it seems like all upside. And then along with electrolytes, and then creatine's another one, protein's another one, and then vitamin D and fish oils. Those are the supplements that I don't hard recommend anybody necessarily, but when we look at the studies of most people are deficient in these and the benefits of taking it, that's where I would say if I recommend any, it's those. And those are the ones that I take personally. Other than that, I think it's kind of a wash.
So as we're talking about, I guess, recovery and supplements that are good to take, I mean, I like to break things down into like daily progress, right? Because I understand how things compound if you do one activity over a long period of time, the massive benefit that can come from that. If we look at like an optimized daily routine, whether that is supplements, whether that is certain exercises, stretches, whether that's sauna, ice bath, like if you were to recommend or just talk about a highly optimized daily routine for people to consider, what would you include in that?
I think one of them is going to be exercise of some sort. There's one guy that I listened to and he talked about, he's like, you can't drink 7 gallons of water on Sunday and expect to be hydrated throughout the whole week, right? It's something a little bit every single day. There's another study that stuck with me and they took, I think they were athletes as opposed to like just the general population, but they were looking at sleep efficiency as opposed to like sleep duration. So how good of sleep did you get? And they took these people and they had them work out at 7 a.m. and then they measured how good of sleep that they had that night. probably waited a week or whatever, did it again, but they had them work out at 1 p.m. and then they did it again and they had them work out at 7 p.m. And they found that working out at 7 a.m. is ultimately the best for sleep, where you're going to get the most recovery throughout that sleep because you're not still jazzed up from the workout. Plus, we know that's when cortisol and general energy is highest, is at the beginning of the day. So if you can put all of those like hormones of cortisol and your energy in general to work right out the gate, it's going to be the best. You're going to be the most tired and sleepy kind of at nighttime. And so I would say exercise daily in particular. I'm pretty sure the recommendations is like 150 minutes per week of like moderate level or 75 of vigorous. If you talk about like, the standards that no one meets, it seems that would be exercise every day. Even through COVID, I made sure to like wake up at 6 a.m. I drank my coffee and I was like walking barefoot around my neighborhood. And I actually had a guy, he's like, "Are you the guy that walks around with a mug?" And I'm like, "Yeah, that's me in my pajama pants." Yeah, that's me. So I would say movement first thing in the morning, if possible. Daily routines. The other thing too is I've found to have huge benefits of drinking a lot of water and then electrolytes in the morning. I've actually felt different doing it, so I would highly suggest that. When I started learning about energy and like ATP and ADP and how coffee works and stuff like that, I do think there's a massive benefit in waiting an hour or so before drinking coffee. I don't follow that because I really enjoy drinking it right when I wake up, because I've got anywhere from 20 to 45 minutes before my kids wake up. And so I am drinking it when I come up. But I don't notice any huge negative side effects, so it's not worth that, right? It's, like, the routines are cool, but if you can't actually implement them, and they kind of don't matter. But if you can, I would say wait about 30 to 90, probably 60 to 90 minutes before consuming that. In regards of sleep, if you can get a good nighttime routine, it does not need to be all big and fancy, but just like the last 30 minutes to an hour, trying to reduce the amount of electronics you're on. Ultimately making sure your bedroom is like no overhead lights, it's just a lamp in the corner. Seeing if you can read in bed. Well, actually, I'll switch on that. Read of some sort to kind of calm the mind. But the other thing too is reserving the bed for sleep and sex only, so that your brain knows that if I'm getting into bed, I'm going to sleep. Like, the more that you can just treat your body like you are a 5-year-old toddler and just condition it, the better it's going to be. Waking up within 30 minutes of your normal wake time every day, going to bed within 30 minutes pretty much every night, keeping the room dark, cold. If you like a little bit of white noise, something like that to kind of drown stuff out, that's also good. And then the rest of the daily routine is ultimately, I think, more focused on diet. And it's making sure you're getting adequate amounts of protein and fiber each day. That would be my other piece. So I'm essentially listing off to you my 4 pillars, or our four pillars at our clinic. But when it comes to protein, I think the minimum recommended dosage on like nutrition labels is like 30%. It breaks down to about 30% of your body weight in grams, which is like,
that's it.
Yeah, it's super low. Like, it like blows my mind how low it is.
Yeah.
And I think wherever they got that number, it breaks down to essentially like you won't die if if you meet this number.
Yeah, I've always heard you want a gram per pound of body fat, or not a gram per pound of body weight.
Yes, and if you're someone who's losing weight, it's a gram per goal body weight. So if you're at 250 and you're trying to get down to 2, then go off 200.
And I've heard the vice versa. If you're trying to bulk, it's a gram per goal body weight.
Yeah, I've heard 1 to 1.5 times whatever you're currently weighing. I agree. And they've also debunked the whole idea of you can only absorb 30 to 40 grams. It's like, no, there's no limit. Like, eat as much as you want.
Isn't that crazy? I saw that one.
Yeah, and it's like, why are we so concerned that, don't eat too much protein at once? It's like, I never question myself when I eat a whole bag of Doritos. I'm like, what am I going to do with all these carbs? I'm like, no, my body will figure it out. And so, yeah, going back to the protein thing, 30%, 30 or 30 something percent was like the recommended thing, which is like a crock. They found like 50% is essentially minimum to maintain whatever muscle mass you have. 70% for average person was actually enough, it seemed. Like, people could still grow mass on that as long as they're eating 70% of their body weight. So if you're a 100-pound person eating 70 grams, the goal is probably 1, and then I think it tops out about 1.2 to 1.3. But if you still need calories, you might as well pack them with protein. Don't get me wrong. But the research kind of fades out about that 1.2, 1.3 grams per pound of body weight.
There's this interesting maybe misconception or ideology amongst, particularly, I think, women is where I've seen this, is they're like, I don't want to eat too much protein. I don't want to get big. I would love for you to kind of talk through why that's not a great idea.
Usually I look at them and say, I've been trying to get bulky my whole life, girl. And like some may think I have muscle, but it's like, I've been trying.
Yeah.
Okay. And men, we know, have a general advantage of muscle building. And so if you are that scared, please tell me what you're doing to get there. Now, don't get me wrong. there are certain girls in the CrossFit gym that I go to that a lot of women probably don't want to look like.
Yeah.
And I think they look good in regards of physique because they've got good muscle.
Yeah.
But if you were there and you saw that they're there 5-6 times a week working out for an hour and a half, like I will show up there already in their workout, not their warm up, they're in their workout. I will do a 45-minute workout, shower, walking out. They're still working out.
Yeah.
It's like, you will not be them. I promise you,
But
type of thing.
But I think that there's this idea that protein is purely a tool for building like massive, large muscle. And like it's actually a vital piece of nutrition for your body and its cognitive function as well.
It is for sure. And so making sure you're getting enough protein and make sure that you can grow muscle or at least keep muscle. And I think when you really walk down this path with someone, you can really open their eyes pretty quickly, because when they come to me and they say, I want to look this way, feel this way, do this thing, it's going to boil down to you need more muscle and probably you need less fat. And generally the thing that is sold to females is, oh, you should be more toned,
Mm-hmm.
right? Well, first of all, toning is not a thing. Doing more reps at lighter weight is not going to, quote, get you more toned. Getting a bigger muscle and getting less fat is going to get you toned. And that boils down to, are you doing what it takes, eating enough protein and teaching the muscle that it needs to be stronger through a workout to grow said muscle? And then are you eating low enough calorie to make fat go away? Because it's the only way you're going to expose muscle.
Mm-hmm.
And what's nice, and this was a huge learning experience for me, is in 2015 or 16, I did a men's physique competition. And what I learned through the 15-week cut is the last 5 weeks, I was an asshole. Hopefully I can say that. I was not a nice person. I was so low calorie and so like, quote, starving that I was just irritated all the time. Very not happy about it. And I realized like, wow, if I want to look like, Dwayne Johnson, if he had like 100 pounds less muscle, and then I had to feel like this, then I'm never doing this again. Like, this is not worth it to me. But the coolest thing that I think I took away was like, you can make your body look however you want. This is coming from like a 22-year-old male. So I acknowledge that, especially because a lot of the people I work with are females going through menopause.
Yeah.
But it really is just calories in, calories out, and then doing the right things in regards to strength training to make that muscle be there. And so if you were a female, my coworker in specific, actually, she gained 60 pounds in college, went through a very bad breakup, and then ended up losing it all. Went down like where she said like, I was way too skinny and way too like muscular. And then she's kind of bounced back up. And so she can speak heavily to the fact that like, you can kind of like be where you want to be, depending on the amount of discipline you're willing to put in. But treat your body with patience and treat it kind of like a little bit of an experiment of like, I wonder if I eat 1,900 calories, 140 grams of protein, do carbs and fat kind of however you want. Make sure you get your fiber. Do that for like 6 to 8 weeks and see how you feel. See what you look like. Are you trending in the direction you want to go? And then ask yourself, can I maintain this? Do I want to maintain this?
Yeah.
How is that going ultimately?
I think a lot of that comes down to just be willing to try things. Like I think a lot of people, again, whether it's like this is true in starting a business, like it's analysis paralysis. I don't know if this is going to work. I think it's the same generally in health. It's like, I don't know if I take the supplement or if I start this workout or if I monitor my calories. Like a lot of people are afraid to weigh themselves because they don't want to physically see that what they're doing is not working. Whereas you could view that as, hey, I've tried one thing, this didn't work. Let's change the combination. Let's isolate one of the things I'm doing. Let's remove something. Let's add something. Like treat it like a science experiment until you dial it in and figure out what is actually going to help you.
I think the reason people don't weigh themselves is because it forces it to be their fault.
Right.
It forces them to look at it. And it's like, oh yeah, I'm kind of gaining weight. Like, I don't know. And you leave this as this like thing up in the air as it may be my fault, it may not. But it's like the second you weigh yourself, you're now assuming responsibility. And now if it doesn't work, you failed. Now, there's arguments to be said about whether you failed and stuff like that, but it creates ownership. And I think that intimidates most people. If we go on to that conversation ultimately.
I think one thing I want to close the loop on, how many grams of fiber?
Oh, good question. So that's going to be like 30 to 35 grams. I will say, if you leave this podcast or you're listening on your like way to work and you eat 30 grams of fiber today, your spouse or whoever's right in the car with you is not going to like you if you're not used to it. But gradually working up to 20 to 30 grams is more realistic ultimately. And sometimes that's just eating more fruits and vegetables, which is probably the easiest and best way to do it. But even swapping things like I just recently found the carb counter tortillas. I always knew they existed, but I just assumed they were bad. It's like, dude, those things are actually amazing. And there's 14 grams of fiber in there. So finding those little things to rope fiber in is going to be helpful. The reason fiber is helpful for you is not only does it help control blood sugar, helps you feel fuller ultimately. The calories from fiber generally don't count as much because they're not really absorbed in the body. But when it comes down to the lower part of the intestines, generally the colon, it does two things. Is if you're having more of like diarrhea types, like bowels, it will actually create bulk and help clear that up. However, on the flip side, it kind of fixes both. If you're more constipated, it'll draw in more water and also help pass. So just consuming a good amount of fiber will actually help both sides of the chart in regards to having bowel movements and stuff, especially because, at least what I've been hearing in regards to research, is colon cancer is on the rise for people your age and my age. And we can go into a whole conversation on diet with that. But I think a lot of it is because we don't eat as much fiber as we once used to. And so making sure you're eating your fiber to where that like your metabolism and your like actual bodily processes are happy, but it's also going to make you feel full. And then also eating enough protein to make sure that your muscles are building so you can be toned and or you can have a nice amount of muscle on you, which also helps blood sugar control too.
And I know you need to run soon, so I'm going to start to do just a couple rapid fire questions here as we wrap up. A lot of things on creatine right now. What do you think creatine?
I think creatine's, everybody should be taking it. Honestly, it's the cheapest supplement, the most researched supplement. I actually just heard a follow-up study or a follow-up conversation. There was a study that showed it actually has really, really good like cognitive benefits.
Yes.
But one of the studies specifically around Alzheimer's essentially showed that it could be helpful with either halting or reversing Alzheimer's. Could be. Because there was a doctor that I follow that she kind of like tore it apart. She's like, there was no control. They just gave it to people and noticed a difference, but now they need to dive deeper. So I think we're starting to kind of unfold those. On creatine, you don't need to do a loading phase. You just need to do 3 to 5 grams a day. You don't need to cycle on and off. You can take it indefinitely. You don't need to consume it with carbs and juice. It used to be like you have to throw it in grape juice and like down it. You don't need to do any of those things. Just 3 to 5 grams a day, every day. At first, you may have a little bit of like upset stomach as long as you're consuming a good amount of water. You don't need to overconsume. Just drink a normal, adequate amount. That should pass. If it doesn't, then maybe look at the creatine you're buying, or consult with a medical professional and kind of ask why. And then the last thing on creatine I would say is honestly, trust the brand. So find a brand that's third-party tested or just a reputable brand, and make sure it really just says creatine monohydrate.
Nothing else.
No, like the Crea. I don't know if Creapure is one of them, but there's one of them out there that's like $50 for like 20 servings, and it's got all this extra stuff that's supposed to absorb faster. I'm like, no, creatine monohydrate, it should cost $20 to $30 for like 40 to 80 servings, and then last you a long time. But yeah, creatine's big thumbs up on there.
So I love creatine, big fan of it, take it every day. I've actually heard, I don't know if it increases alertness or decreases the feeling of tiredness, but if you increase your grams on a day where you got less sleep, you woke up, you're kind of foggy, because it does cognitively help you, you become more focused, and either does one of those two things. So it kind of can help you combat some of those negative side effects of a bad night's sleep.
I've heard 10 to 30 grams.
Yeah.
Which I don't know how that'll affect everybody's stomach necessarily, but yeah, you can boost it. And I've done that on nights that I haven't had as much sleep. I'll hit 10 to 12. Honestly, I can't argue whether or not I really noticed a difference, but I never noticed any side effects or adverse negative effects.
Yeah.
But yeah, you can definitely boost it.
I've done it too, and I think it helps. Okay, hydration before we wrap up here. How much do you think people should be drinking per day of water, and then hit on electrolytes?
I generally say start with half your body weight in ounces. Start there. Because if you think about, let's say a small 100-pound female desk worker who doesn't really sweat that whole day, doesn't need to drink as much. If you're doing like a sauna, but you also ran that day, and you're generally working outside because you also mow lawns, like you better be throwing back lots of water. Yeah. So I would say, like I weigh 180 pounds. I'm trying to drink 120 to 180 ounces of water. I think a gallon is a simple, good way to start, but like try it for 2 or 3 days if you've never drank that much and see how much you pee, see how you're doing and stuff like that. And then if you're somebody who sweats a lot, definitely some sort of electrolyte supplement. I think there was a study that came out that shows like if you're sweating for an hour, you'll probably get rid of about 1,000 milligrams of sodium. And so you should be intaking that probably right back ultimately. I like 2 different ones. I like Element. That's the ones that we sell. I really like because it's bare basics. However, I recently came along Redmond Real Salt, and they have Relight. I like theirs a lot better, purely because of taste, flavor, and they actually have some other stuff like ginger, turmeric, elderberry mixed into some of theirs. And so I like that one better, but both of them work. I actually have Element with me now, and so I'm not like a hater of one, but those are the 2 that I've found to be ultimately the best. I've actually had one patient, she was living in Alabama. She was in the National Guard, sweating a bunch, drinking a lot of water, tons of water. Moved back here, still drinking tons of water, and all of a sudden started getting a ton of brain fog and super fatigued. Came to find out that because she wasn't sweating near as much. She actually like washed out her electrolytes. She went and got tested. Her potassium and I think sodium as well was like super in the tank. And so you have to have both. You have to have water and you have to have electrolytes, especially if you're not a high consumer of salt in your normal diet.
Yeah. I'm a huge fan of electrolytes. I've used both those brands. I like both of them. Clayton, where can people find you online if they want to reach out, connect, learn more?
Good question. So I finally got it all across the charts. So you can follow me on Instagram, Facebook, and TikTok is at the Doc Dir, at THEDOCDIR, because my last name is Dir. Or you can just go to thedocdir.com to keep it really simple into one website.
Awesome. You can find me on Instagram at Jacob O'Connor. The podcast is at Real Period Conversations. Clayton, thank you for coming on, man. I really appreciate it.
I appreciate you having me on. I'm glad to be somewhere where I can, like you said at the beginning, give people hope. I think that's what our clinic does the best at, is gives people hope on that they can fix their issue.
Yeah. Thanks, man.
Yep, we'll see you.